Just making sure we're all good on our streaming platform. Okay. Hi, everybody. Welcome to our April office hours with Dr. Cunningham. We're going to go ahead and get started in the next minute, but in the meantime, I wanted to go ahead and introduce who we are here at Paloma. So my name is Alex Ruiz. I am the Director of Content and Community at Paloma Health, where we specialize in hypothyroidism and Hashimoto's. So what does that mean? Unlike a lot of other companies out there, we are an actual online medical practice. We're not just like a testing kit company. Even though we do provide an at-home thyroid test kit, what I love about us is that we actually are able to treat you as patients. So we are able to provide you a test kit, which is so amazing. You can do it from the comfort of your own home. It's finger prick, which is really great option for a lot of people, unfortunately, who are maybe like scared of needles. We've heard so many patients being like, I love that you guys even offer this as an option, so I don't have to go in for my labs. But yeah, you're able to see awesome providers like Dr. Cunningham from the comfort of your own home, or, in the car or your mom's house or wherever. That's the beauty of virtual medicine. You can really be wherever you're most comfortable and get, good quality care. But we're more than just that. We have an awesome app that provides workouts and meal plans and suggested recipes. We also have symptom tracking opportunities. So, if you're trying to figure out if day over day, if I'm improving, this is definitely an option for you. And the app is free, which is so amazing. We have nutritionists on staff. So let's say if Dr. Cunningham feels like you need, some nutritional support, you can work with our team as well, get on like a supplement regimen and everything that's really tailored to your specific personalized needs. So that's us at Paloma. If you have any other questions or anything, you could always head to our website at palomahealth.com. And without further ado, we're going to get started in our office hours. So office hours is your chance to really ask the experts anything. So last month we had Mary Showman. This month we have Dr. Cunningham, which if you guys aren't a current patient of his, he's one of our providers here at Paloma Health. So you actually get to have the chance, depending on your state, work with him as a provider. So this is your chance to really, the floor is open, ask any questions that you may have. So without further ado, I'll go ahead and let Dr. Cunningham introduce himself, a little bit about his history, why he got into thyroid health, and then we'll go ahead and get started with our live Q&A. So without further ado, Dr. Cunningham.
Good morning. It's a pleasure to be here. As Alex said, I'm one of the physicians that works here providing care for hypothyroidism. I am board certified in family medicine, integrative medicine, and got into this world mostly through a lot of anecdotes and stories about people needing more nuanced and personalized thyroid care. And it has just become a richer and deeper well of intellectual curiosity over the years for me. So I really enjoy doing it and tinkering with people's treatment plans and helping them develop a more holistic approach to their thyroid care. And I'm here to answer your question. So I just saw one come in, which flashed before me pretty quickly, but I think it said, why would somebody be on T4 only medication like levothyroxine? If that is not the question, then feel free to correct me, but it's a question that comes up a lot. So historically, like say 50 to 60 years ago, when people were identified as having hypothyroidism, the medicine that was used was thyroid extract from pigs. And this medicine contains not only T4, but some other thyroid hormones, including T3. Around the advent of synthetic T4, they also discovered that our body converts T4 to T3. So the paradigm shifted very quickly to moving the standard of care to using T4 as the primary treatment for hypothyroidism. And that's has sustained for a really long time. People that are more in the know or have had a response from taking that levothyroxine or T4 only containing medication, and not necessarily felt much better. Now, and for many years really have the ability, depending on the case, to add T3 containing medication to their treatment plan, which I think is what this person's question is wondering about. Why would somebody be on T4 alone? The short answer to that is that a lot of people do fine on just T4. So we're all different. We have genetic differences and nutritional and physiological differences that make some people with hypothyroidism feel perfectly fine on T4 only medication because they're converting it and utilizing it appropriately to feel well. But that's not everybody. So that's part of what we do, is try to identify based on somebody's symptoms and labs whether or not a trial of a combination therapy is good for them.
Hey,
All right,
Andy, just wanted to flag, if you open the chat box, you can see the questions for a longer period
perfect.
of time so you could read them better.
Oh,
Yeah, we
great.
have,
Okay.
yep, yeah, you have some more questions coming in. So,
Okay, so this next one that I see now is best strategy to control Hashimoto's with concurrent intestinal dysfunction, constipation, SIBO, and no gallbladder. I think this question is, excuse me, I'm going to take this wind chime down real quick. It's windy where I live, and the birds are out, and the wind chime is making noise. So, thanks. So this question, I think, is more of a gut health question than a Hashimoto's question, probably. It would be my approach to it. So I guess this scenario is that somebody has Hashimoto's, but they've also got some gut health conditions and lack of a gallbladder. And constipation, as many of us know, is a common symptom with hypothyroidism. There's a little bit of a chicken and egg situation. If somebody has well-treated hypothyroidism and they still are constipated, then the source of their constipation is more likely related to gut things, which can be dietary, can be microbiome imbalances, or dysbiosis, can be um, enteric nervous system problems where they've got motility problems. But if the person has been diagnosed with SIBO, then really the trick would be getting a comprehensive approach to managing SIBO, which is really challenging. SIBO is a condition that is evolving and understanding, and um, there's high recurrence rate. So there currently the standard of care is to use herbal protocols, which have been kind of compared to antibiotic treatments and found to be pretty effective, sometimes more effective than antibiotics. But even with herbs, diet, and rifaximin, which is a non-absorbable antibiotic that's used for a particular type of SIBO, the recurrence rate is high. So how does this interplay with Hashimoto's? Well, SIBO and constipation, all this can SIBO can be considered a gut inflammatory disorder that might cause immune dysregulation because so much of the immune system is in the gut. And if the gut immune regulation is not great, then that will downstream cause Hashimoto's problems. So I think that the answer to this question is to manage the Hashimoto's optimally through dietary measures and the right medications to get thyroid optimized, or the amount of medication in the system optimized, and then address the SIBO and constipation at the same time through a gut first approach. I'm going to go to the next question here about supplements for Hashimoto's, essential vitamins that we'd be looking for that. So there are a lot of thyroid support type supplements on the market. I don't know how many of them are kind of indicated for Hashimoto's per se, but we do know that there are a number of micronutrients that are essential for optimal thyroid function. These include iodine, selenium, magnesium, zinc, tyrosine. Um, Thyroid hormone is essentially made of tyrosine and iodine. And iodine is tricky because too much iodine can be problematic. And most of us in Western society are not iodine deficient because there are so many iodine is added to salt, which is added to so many foods that we eat. So when somebody's taking a supplement with iodine in it, I like for them to look and make sure that it's not well above the recommended daily allowance, because just the appropriate amount of iodine is good. Kind of mega doses of iodine are often more problematic. But I think selenium is important. Um, Magnesium, zinc, those are probably the things that I most commonly look for myself when I'm comparing thyroid supplements. I frequently recommend that people take the Paloma Daily Thyroid Care supplement that is available here because it's high quality, it's good value. We know what it is. So you might, if you don't want to take that one, I would compare others to it and use that as a good benchmark. Okay, next question is insight into long-term effects of medications for hypothyroidism. I don't know if the concern here is that the person has concern about risks. Let's see. I mean, the long-term effects of medications for hypothyroidism, in short, I would say that if somebody has hypothyroidism, then the benefits of being on medicine to replace their deficient thyroid hormone really outweigh the risks. And the reason being that untreated hypothyroidism can have negative health consequences like metabolic sluggishness, which can, also parlay into hyperlipidemia and weight gain and things like that, including, depression and a lot of the other symptoms we see with untreated hypothyroidism. So long-term risks of medications for hypothyroidism really depend on the particular situation, but I don't normally think about these medicines as being high risk. There are some people who are more sensitive to T3 containing medicines or T3 than others, and so I generally am more cautious about prescribing them and kind of um, sort of risk stratifying somebody's ability to trial those medicines. If somebody had an arrhythmia, for example, a cardiac rhythm problem, then they may be not doing great on a T3 containing medicine, and that would usually be avoided in that scenario. Okay, I'm going to go to the next question, which is a lab interpretation. So I'm not sure. Let's see. So the background is that this person is historically hypothyroid, but has fluctuating levels that kind of sway back and forth. Now, the lab interpretation is here that the TSH is 0.57. So this is on the lower end of the normal range. It wouldn't actually fall into a category of, hyperthyroidism, but it just demonstrates a more aggressive management. And the reason that the TSH is on the lower end of normal there is likely because the person's on enough medicine to make their free T3 level a little high. So, which is this, and okay, so the concern is the person has hypothyroidism, but their current labs demonstrate that they fall into a hyperthyroid category. This is kind of on the borderline of being overtreated, I would say. So it's not dramatic. It's not a cause for serious concern. I don't know the rest of the health history and other parts of this management plan, but the likelihood is here that the dose could be decreased a touch, not a ton. And if somebody was feeling okay, then the T3 would probably come down a little bit, which would then, through a feedback um, loop, allow the TSH to rise up a little bit higher. TSH, just a quick reminder, the TSH is a hormone that is secreted by the pituitary gland. So TSH represents sort of how our brain is reading how much thyroid hormone is circulating. Sometimes I explain this to people in saying that like the TSH is kind of like looking at the thermostat in the house. And free T3 is the circulating physiologically active thyroid hormone. So yeah, the short answer here is if you're concerned about those labs and could tolerate a mild dose decrease, then that would maybe be the move. All right. Question, can food sensitivity change over the Hashimoto's journey? Food sensitivities can always change, and this doesn't only apply to Hashimoto's thyroiditis. Our guts and the gut barrier and the sort of intestinal epithelium and the interface with the immune system can always change, and other environmental allergies can change over time as well. So this person, I'm reading between the lines a little bit here, but they said, I've given up gluten in the past and didn't notice a difference in my symptoms. And maybe they're wondering if they should retrial that. I do often, most of the time, recommend people with Hashimoto's trial off of gluten. It doesn't always impact their energy and other indicators of thyroid balance, but sometimes people notice things that are not gut related. Like they may notice by eliminating something they're sensitive to that they've got improvements in their skin, or their rashes go away, or their joint pains improve. Anecdotally, I've just seen a lot of different responses to elimination trials. So the answer is yes, food sensitivities can change. All right. Oh, this is a good one. The next one here is about after a total thyroidectomy, does Hashimoto's completely go away? And I'll take a crack at it, but I don't know if this is a real black and white answer. So Hashimoto's is an autoimmune condition which has the thyroid as kind of the primary victim. So, but Hashimoto's is not only a thyroid condition, it's an autoimmune condition that, as all autoimmune conditions pretty much go, disrupts the immune system. So there are some Hashimoto's symptoms that are not a direct consequence of somebody's thyroid balance. So if somebody with Hashimoto's has had a total thyroidectomy, then they're going to be reliant on thyroid medication. So the antibodies against the thyroid that are produced are not going to be able to sort of land on their enemy, the thyroid, but they may still have some other residual symptoms, which could be gut symptoms or other things that are not necessarily considered thyroid symptoms. So I would say Hashimoto's doesn't necessarily go away. All right. Next question is, can you explain an incident when thyroid medication would not be necessary? I don't want to be on medication forever. Is that possible once I have hypothyroidism? Hypothyroidism most of the time is lifelong, depending on the cause. We've talked a lot about Hashimoto's, which is the most common cause of hypothyroidism, but there are other causes like pituitary dysfunction from a higher level control. So the situations where thyroid medicine might not be necessary, I'll give a couple examples. One would be there are a lot of people who have Hashimoto's with elevated antibodies, but don't actually have dysregulated thyroid. So the scenario there is you get your labs done, your TPO antibody levels come back really high, your thyroid hormone levels are normal. What does that mean? Well, that means that you kind of have a setup for hypothyroidism. But if the thyroid hormone levels are normal, then you wouldn't need to be on medicine. But we could do our best to preempt that progression by focusing on the usual things that influence immunity, like sleep, management of stress, optimizing the micronutrients, um, gut health, things like that. Now, another scenario where we see people get diagnosed with hypothyroidism, but then it may go into resolution. Probably, one situation I see with that is women who develop hypothyroidism during pregnancy or in the postpartum state. And in that population, the percent of them who have long-term hypothyroidism is definitely not 100%. A lot of people who have postpartum hypothyroidism or peripartum hypothyroidism may be on medicine for several months or something like that. But then if we monitor labs and gently reduce their medication, they may be able to come off of medicine. The situation where somebody with Hashimoto's that has been on medicine for a long time and is able to put it really into complete remission um, is something I believe in, but I will tell you, like clinically and anecdotally, it's rare. And I don't say that to be a pessimist. I inherently believe in our body's ability to heal themselves, but genetics plays a big role in this too. And sometimes all the positive lifestyle changes and supplements and everything in the world can't overcome the genetic inertia of pushing somebody into hypothyroidism. So hopefully that answered that question. Yeah. All right. The next one that I'm seeing here is about Graves and Hashimoto's. How is it possible that somebody can have both at the same time, even though they're opposite? Um, This is a great question for people who don't know. Graves' disease is an autoimmune condition given the name Graves, just like Hashimoto's is just somebody's name. These are both autoimmune conditions that have opposite impacts on the thyroid. Graves' disease produces antibodies that usually cause people to develop overactivity of the thyroid gland and may lose weight and feel ramped up. And basically, it's kind of like if you're driving on the highway in third or fourth gear. It is possible, and I've met I've met a good handful of people within the last couple years who have Graves and Hashimoto's and have been treated and are kind of on the other side of Graves' disease. Like maybe they had their thyroid irradiated to get it under control, or they might have taken anti-thyroid medications to suppress thyroid function because of the Graves' overactivity, but they have persistent Hashimoto's. But yeah, I mean, they have a similar sort of root cause here. I mean, they're both autoimmune. Hashimoto's is way more common than Graves' disease. This could be a result of different areas of the thyroid having tissue that like follicles that are overactive or underactive, but it's a rare possibility that some people do fall into this category of having both. And the sort of the treatment triage on this one usually is that the Graves tends to be more powerful than the Hashimoto's for a lot of people and requires dialing thyroid activity down first. But a lot of people with Graves end up being on thyroid medicine because it's hard to very delicately like control the thyroid to a degree where you get it right at the sweet spot. So a lot of times they'll lose thyroid function and then need some thyroid supplementation long term, which is more ideal long term than being on anti-thyroid medicine long term, which tends to be more difficult to control. Just a quick drink of water. Can having fatty liver make my hypothyroidism worse? Okay, fatty liver is a consequence of deposition of fat in the liver. Most commonly, we see this when people have blood sugar regulation problems or high triglycerides. And it causes inflammation in the liver. It makes the liver not function as well. There's some long-term risks of fatty liver. Contextually, some people know about kind of the benefits of carrying extra weight in, say, your hips and legs and thighs versus in your midsection. And the reason that generally there are poorer health outcomes with being kind of more apple versus pear deposited with fat in the body is that our internal organs mostly are in the midsection here. So if somebody has fatty liver, then that can impact their hypothyroidism, because it is inflammatory, and fat is can become an endocrine organ, and dysregulate hormones like estrogen and things like that. But also that the liver has a role in interconversion of thyroid hormones. So generally we think if somebody has liver inflammation or liver disease or gut dysregulation, that their response to hypothyroidism treatment may be, a little bit more difficult. So I would say, think about this not so much in terms of whether your hypothyroidism is getting worse, but more about really, getting to the heart of what's causing fatty liver and doing your best to reverse the conditions that are potentiating that, which might mean lower carbohydrates, less processed fats, more exercise, things like that, that would help enhance metabolic function of the body and mobilize fat, because there are other health benefits to that. This is a good question. The next one about black cumin seed oil, which I know the Latin genus name is Nigella, I think, and I haven't done the deep dive on this yet, to be honest. I love botanical medicine, and this will prompt me to read more about black cumin seed oil and its influence on thyroid health. But I don't want to speak to that without having a lot of knowledge about it offhand.
Alrighty, guys. Well, thank you so much, Dr. Cunningham, for all of the questions. That's all the time we have today in our live Q&A. For anyone that has any other questions, you can always contact us on social media. We're pretty active there at Paloma Health. You go to our website, palomahealth.com. We have a bunch of different resources and blogs. And then again, if you're looking to, have a new provider or need help managing your thyroid symptoms or just your thyroid care in general, go ahead and see if Dr. Cunningham is available in your state, and you can go ahead and become a member and book an appointment with him. So yeah, thank you so much, Andy, for joining us for today's event. I know people really love these, so I'm glad we're doing these, and you joined us this month. So appreciate you
pleasure.
being
Thanks
here.
for having me.
All